More hospitals reach full capacity, the government is working on a plan to free up beds in medical centers. Officials want to establish a patient navigation system for COVID-19 patients. Let's find out more about this initiative from Isolation Czar Public Works Secretary Mark Villar. Secretary Villar, thank you so much for joining us on The Final Word. According to the World Health Organization, they are currently encouraging the Philippine government to make better use of the quarantine facility. So, Secretary, are we going to see more patients with mild symptoms moving from full capacity hospitals to the isolation units?
Well, we want to make these facilities available to all, and we want to increase the types of facilities that will be available. On our part, you've seen the ones that we built, which are utilizing large common areas.
Mhm.
The new ones that we'll be building will be focused more on quarantine facilities. So it will be composed of individual rooms, and this will allow us to upon testing, this will give us the flexibility and allow us uh, to place those who are in danger of infecting others, to place them under quarantine so that they will no longer be able to affect the community.
But Secretary Villar, why do you still have to build these additional facilities when, according to the Department of Health, only 25% of the over 70,000 beds managed by local governments are occupied, and only close to 40% of the 3,200 beds in mega quarantine facilities are occupied?
Two things. First, we want to anticipate. We've seen an increasing number of cases, and of course, we don't want to be unprepared. We want to make sure it's better to be safe than sorry. And secondly, we're also the type of facilities that we might need would be different. We need more facilities that have individual rooms. We've already built one in Quezon City Memorial Circle. We've also built in PICC. These are made of container vans, and they have individual rooms with their own aircon, with their own CR. This will, the facilities, some of the facilities that we built are okay for patients that have already are positive for COVID. So there's no danger that they would infect others. But for those we're not sure yet, who still have pending test results, we need to put them in facilities that have an individual room so that there's no
Okay.
danger of contamination.
So, Secretary Villar, what will be the capacity of these additional quarantine facilities that will have individual rooms?
Well, we've built we have different types of models for different purposes. We have one that's designed for the frontliners and we'll build it near hospitals. We have also one that's designed that can be used for either LSI, or it can be used for those who are not yet they're still awaiting their test results. We're not sure, but they could be infectious. So they're really different models. But like, let's say in a cluster that we build, we can fit about 32 people in a single cluster of container vans. And what's nice about these container vans is they're movable. So they're modular units. They can be moved to areas as we need them.
And apart from Metro Manila, where will you also be building this new type of model isolation facilities?
Wherever there's a high level of cases of COVID-19. For instance, we've already identified 11 sites in Cebu that will be building
Mhm.
quarantine facilities. We'll be spending almost 300 million pesos for numerous quarantine facilities that will uh, allow us to execute our strategy, which is to test, trace, and when we find them, we isolate them until they get better, so that the spread will be limited.
And now, of course, you have yourself, you are the isolation czar, you have a tracing czar, you have a treating czar, and then you have a test czar. Coming all together, your plans for this fight against this unseen enemy, when do you target to bring down the numbers, which are currently, well, today was more than 600, but over the past week or so, it has exceeded more than 1,000, Secretary Villar.
That's why we have to be aggressive, and that's why we've the IATF has identified us to really focus on this problem. So you'll see that we'll be tracing very aggressively. There'll be testing. In fact, our testing has reached a level. It's already reached a very high level of tests per day. And now, once we've tested and once we've identified them, we need the quarantine facilities to isolate. So that's where we come in. We'll be building as many isolation facilities as needed. And eventually, with this strategy, we hope to bring down the COVID cases and return to some normalcy.
By joining this team of anti-COVID-19 czars, Secretary Villar, in your view, what more needs to be done for the Filipino people to be able to beat this enemy?
Well, this COVID-19, it's not gonna go quietly into the night. We have to be aggressive. We have to, and it can't just be the government. It has to be everyone. Everyone has to be aware. Everyone has to protect themselves, and they must follow the guidelines set forth by our medical experts. But on our part, we'll make sure that we everything that the government can possibly do with the resources that we have, we will do it, and we will do it at the soonest possible time. We'll be very aggressive in the next. Well, starting, we've been aggressive, but we'll continue to work aggressively to stem the increase in COVID cases.
Isolation Czar and DPWH Secretary Mark Villar, thank you so much for joining us on The Final Word.